Let's talk about the measles outbreak in West Texas because this one is serious. More than 100 cases, a confirmed death, and a growing public health crisis. And all of this is happening as anti-vaccine rhetoric is hitting new heights. So let's break it down. Right now, 124 people in Texas and 9 in New Mexico have tested positive for measles. Most of them, kids. Gaines County, one of the hardest hit areas, has some of the lowest vaccination rates in Texas. Nearly 14% of K through 12 students there have opted out of at least one required vaccine. That's a problem because measles spreads fast. Measles is a highly contagious airborne virus. It can live in the air for 2 hours after an infected person coughs or sneezes. And it's not just a rash or fever. Measles can cause pneumonia, brain swelling, even blindness. This outbreak, it was preventable because measles was eliminated in the US in the year 2000. The vaccine is one of the greatest public health achievements of all time, but vaccine skepticism has fueled a comeback of a disease we had already defeated. And speaking of vaccine skepticism, this outbreak is happening just as Robert F. Kennedy Jr., one of the most high-profile vaccine skeptics, is taking over as head of the Department of Health and Human Services. And so far, silence from him. But in the past, RFK Jr. has blamed vaccines for measles outbreaks. In 2019, when children in Samoa were dying from measles, he claimed it was the vaccine that was dangerous. That's just not true. The outbreak in Samoa, just like this one in Texas, was due to low vaccination rates. We've seen this before. In 2015, an outbreak started at Disneyland and spread across multiple states and countries. The cause? Unvaccinated individuals. Let's be clear, the measles vaccine is safe, effective, and it works. Before the vaccine, millions of kids got measles every year. Hundreds died. The vaccine changed that. But when people stop vaccinating, diseases come roaring back. So what can you do? First, make sure you and your family are up to date on the MMR vaccine. The CDC recommends kids get 2 doses, one at 12 to 15 months, another at 4 to 6 years. If you're an adult and not sure about your status, talk to your doctor. This outbreak isn't just about Texas, it's a warning. When vaccine misinformation spreads, so does disease. Like, share, and follow for more explainers on what's happening and why it matters.